brought up a point I think that is relevant not just refractive surgery, but the rest of ophthalmology and probably life in general, which is you don't know what you don't know. And if all you've ever done is surgery in a certain way and you've only seen your outcomes and that's you kind of live in your own little bubble and you keep doing things that way, you're never going to know what your potential could be. And so if you don't visit other practices, you don't watch other surgeons, you don't go to these conferences, if you don't learn and keep expanding your horizons, you're never going to grow as a surgeon, you're never going to grow as a person. And I think a lot of times people are very dogmatic in ophthalmology, probably in medicine in general. It can only be done this way. This is the way it's done because these are the outcomes I've seen. But if you don't try and learn and constantly question your level of methodology to see how can I make things better, you live in a very closed system. And ophthalmology is a field that is evolving so rapidly. I mean, I look at the IOLs that were out when I was in residency and thinking, wow, this is the latest stuff. I mean, we don't put those IOLs in anymore.
Right.
And the IOLs we're putting in today, we're not going to be putting in 5, 6, 7 years. I tell patients it's like the tech industry. You say you want the latest and greatest laptop, you want the best smartphone. Well, you can have that, but 2 or 3, 4 years from now, something much better is going to be out there.
Correct. No, absolutely. It's going to keep on evolving, keep on changing. And so you have to be willing to, I love the idea of, I try if possible to make it a point to go visit a practice. Because you're right. I mean, there's many different ways of approaching things, and whether it's how you run a practice, it's how you do a procedure, things of that nature. I think it's important to take some time out to go ahead and visit other things of that nature. Because if you remain dogmatic and aren't willing to change, it is very static, and you need to be open enough to realize that there are many different ways of looking at things. Doesn't necessarily mean you're going to adopt everything that you see, but I think that's probably one of the best things you can do is just visiting other surgeons in the OR and just observing.
Right.
And just kind of keeping an open mind.